Welcome to the No HBV HCV online training course developed by the Asian Liver Center at Stanford University. In this course, you may click the pause button and all of your progress will be saved. In addition, you may move between completed sections at any time. To pass this course, you must receive 100% on the final quiz. You will then receive a certificate of completion. Let's begin. The No HBV HCV online training course consists of the following modules. Module 1. Burden of liver cancer and chronic viral hepatitis in the world and in Vietnam. Module 2. Types of viral hepatitis and their transmission routes, hepatitis B facts, diagnosis, and immunization. Module 3. How to prevent the transmission of bloodborne infections, injection safety, and management of needle stick injury. Module 4. Long-term monitoring and treatment of chronic hepatitis B. Module 5. Prevention, diagnosis, and treatment of chronic hepatitis C. At the end of each module, you must pass a quiz before moving on. Now, let us begin with Module 3. Welcome to Module 3, Prevention of Bloodborne Infections, Injection Safety, and Management of Needle Stick Injury. In this module, we will cover 3 topics: hepatitis B vaccination in healthcare workers, prevention and management of needle stick injuries, and prevention of bloodborne infections. Healthcare workers are a high-risk group for hepatitis B infection because of occupational exposure to infected blood, bodily fluids, tissues, and needle stick injuries. The risk of hepatitis B infection in healthcare workers is 5 to 6 times higher than in the general public. In 2003, the WHO estimated there were 3 million accidental needle stick injuries in healthcare workers. These injuries resulted in approximately 15,000 HCV, 70,000 HBV, and 500 HIV infections and their associated consequences, including prolonged illness, work capacity loss, and death. A recent study in Vietnam shows that 65% of healthcare workers reported needle stick injury in the last 12 months. 10% reported needle stick injuries of more than 6 times in 12 months. Therefore, unprotected healthcare workers, including students in training, should receive the hepatitis B infection before patient contact. Healthcare workers should complete the 3-shot hepatitis B vaccine series given over a 6-month period. The 3 shots should be administered at 0, 1, and 6 months, and the entire 3-shot series must be completed in order to obtain long-term immunity. The vaccine should be given in the deltoid muscle of the shoulder. High-risk groups including healthcare workers should receive a blood test for anti-HBs 1 to 2 months after completion of a 3-dose vaccine series. If anti-HBs level is greater or equal to 10 milli-international units per milliliter, it means the person is protected. If the anti-HBs level is less than 10 MIU per ml, the person should receive another 3-shot vaccine series, preferably with vaccine from a different manufacturer, and get retested afterwards to make sure they achieved immunity. For the rare group of people who fail to achieve a protective level of immunity after 6 doses, no further vaccination is recommended. So, how can we prevent needle stick and sharp injuries? Needle stick injury is the primary reason for hepatitis B infection among healthcare workers. In 1983, about 17,000 healthcare workers in the U.S. became infected with hepatitis B from needle stick injuries. By 1995, the number had decreased by 95%, with only 400 healthcare workers who became infected. The reason was routine hepatitis B vaccination of healthcare workers. As a healthcare worker, you frequently come in contact with contaminated needles and sharp objects every day. The risk of becoming infected after needle stick or sharp injury is 23 to 62% from a hepatitis B infected source, compared with 0.8 to 3% from a hepatitis C infected source and 0.3% from an HIV infected source. Safe injection practice will protect you and your patients from bloodborne infections. Follow 3 simple rules to reduce the risk of needle stick injury. Wear gloves, dispose of needles and sharps properly, and do not recap needles with 2 hands.
Always wear personal protective equipment such as gloves to protect you from direct contact with potentially infected blood, tissues, wounds, or bodily fluids. Gloves will also help to prevent the risk of transmission from an infected healthcare worker to patients.
Always dispose of needles and sharps properly. Use the puncture-proof sharps containers provided by your workplace. Here are some examples of appropriate containers. Notice that are all closed, spill-proof, and puncture-resistant containers. Do not put used sharps in open containers or plastic bags, since this can result in injury when they are emptied by the cleaning staff. Do not recap needles. The number one cause of needle stick injury is two-handed needle recapping. It is best to use retractable, single-use needles to avoid this problem altogether.
What if I must recap the needle? For example, if I need to carry the used needle to a sharp container that is not immediately accessible?
If you must recap the needle, it is safe to use the one-hand technique as illustrated in this film. For added safety, the WHO recommends the use of safety-engineered syringes to prevent needle stick injuries. There are three types of safety-engineered syringes. 1. Syringes with a Sharps injury protection feature, SIP devices. For example, a plastic shield which covers the needle after injection. 2. Syringes with the reuse prevention feature, RUP devices. For example, syringe plungers that can be snapped off or cannot be pulled back after a single injection. 3. Syringes with both the Sharps injury protection and reuse prevention feature. In 2015, the WHO highly recommended using needles and syringes that have both these features. Despite taking safety precautions, a person can still sustain a needle stick or sharp injury during a procedure and be exposed to bloodborne pathogens including hepatitis B. In this case study, a man with chronic hepatitis B infection was admitted to a San Francisco hospital in 1983. While undergoing an upper endoscopy and biopsy, a healthcare worker sustained a sharp injury. This healthcare worker did not receive the hepatitis B vaccine because it was not available at that time. Without taking any precaution after sustaining the sharp injury, 3 months later he developed severe fatigue and jaundice and was diagnosed with acute hepatitis B infection. What can you do differently to protect yourself against hepatitis B if you sustain a needle stick or sharp injury? If you sustain a needle stick injury, you should immediately wash the wound with soap and water, then report the injury to your supervisor and infection control as soon as possible, and test the source of exposure for hepatitis B, hepatitis C, and HIV. If your needle stick injury exposed you to blood from a hepatitis B infected patient and you have not been previously vaccinated or you are uncertain of your vaccination history, then you should follow these steps. First, wash the wound with soap and water. Next, report the injury to your supervisor and infection control. Then you should get a baseline blood test for hepatitis B, including anti-HBs, anti-HBc, HBsAg, and ALT level as soon as possible. If you are uncertain of vaccination history, have not been vaccinated, or have inadequate antibody levels, you should receive a dose of 200 to 400 IU of hepatitis B immune globulin, HBIg, given intramuscularly. In addition, you should receive the first dose of the hepatitis B vaccine in a different injection site within 24 hours of exposure. Then you should complete the 3-shot vaccine series in the following 6 months. If you are known to be unresponsive to hepatitis B vaccination, you should receive another dose of HBIg in 30 days. If your baseline post-exposure anti-HBs level is greater or equal than 10 MIU per ml, you are protected and no further HBIg or vaccinations are necessary. Let's talk about how we can prevent the transmission of hepatitis B, hepatitis C, HIV, and other bloodborne infections in the healthcare setting. In In 2000, the WHO estimated that 40% of 16 billion injections were given with reused injection equipment, leading to 21 million or 32% of new HBV cases, 2 million or 40% of new HCV cases, and around 260,000 or 5% of new HIV cases. To prevent bloodborne infection in the healthcare setting, we need to abide by the following principles: practice safe injection, safe acupuncture, safe blood transfusion, and proper disinfection of medical equipment, including dental instruments. The most important rule of injection safety is one person, one new needle, one new syringe. Do not reuse needles, syringes, and IV tubing. IV tubing is contaminated even if it was only connected to a patient's IV infusion bag or pump. Do not reuse a syringe even if you replaced the needle. Use single-dose vials whenever possible to reduce the risk of contamination and transmitting hepatitis B and other bloodborne infections from patient to patient. A new set of needle and syringe must be used to draw from a multi-dose vial. Do not reuse the syringe even if the needle is changed. If a multiple-dose vial of medication is used for one patient, the vial must be labeled with the patient's name and kept in separately in the medication room. A multiple-dose vial should be discarded if it has not been properly stored after opening, if the expiration date or time has passed, or if sterility is compromised. If the packaging for a needle or syringe has been damaged, do not use them. In any instances in which you suspect that sterility has been compromised, it is better to be cautious than to risk transmitting life-threatening infections to your patients. Always prepare medications in designated clean areas where the surface has been disinfected and contamination by blood and bodily fluids is unlikely. The hepatitis B virus can survive up to 7 days on the surface outside the body. Between February and March 2009, an outbreak of acute hepatitis B infection in India caused nearly 240 people to become ill and 70 people to die. The cause of the outbreak was traced to a company that recycled and repackaged used syringes and needles and sold them as new to healthcare providers. What could have prevented such a problem from happening? Use sterile, single-use devices including needles and syringes from reliable manufacturers and suppliers. Non-single-use medical equipment including dental instruments must be properly sterilized or autoclaved according to infection control guidelines. Always abide by the practice of one person, one new needle, one new syringe. Follow safe acupuncture practice guidelines. To protect you and your patients when practicing acupuncture, make sure your work area is properly cleaned and disinfected. All the equipment, including cups, must be properly washed and sterilized. The sterilized acupuncture equipment should be covered with a sterile towel until use. Always wash your hands immediately before each procedure. The use of sterile surgical gloves is recommended, especially if your hands are dry and cracked or if you have an open wound. This is important to protect you as well as your patients from infection. The point on the patient's skin to be needled should be swabbed with 70% ethyl or isopropyl alcohol. The use of disposable, sterile, one-time use acupuncture needles is strongly recommended. All disposable needles should be discarded immediately after use and placed in a puncture-proof sharps container. Non-disposable equipment that may be contaminated with the patient's blood, such as cups, must be properly sterilized and disinfected between patients. All blood and blood products must be screened for hepatitis B and other bloodborne infections including HIV, hepatitis C, and syphilis to prevent their transmission to patients. In addition, make sure you abide by the principles of not reusing needles, IV bags, and IV tubing for transfusion of blood or blood products. All reusable medical instruments, including dental instruments, must be properly disinfected and sterilized between patients according to infection control guidelines to prevent patient-to-patient transmission. Let's review by answering the following multiple choice questions.